I'd been to another urologist who found that my PSA had taken a jump from 3 to 4.5 or something like that, which are still small numbers, but it was the speed with which it went up was something you're not supposed to have. And so I'd talked to another fellow who had seen Dr. Samadi about a year before and swore by how easy the operation had been and how little time he was down and away from his regular goings on. So I remembered Dr. Samadi's name. So I called up thinking it was going to be difficult to get an appointment because he's very, very well known, and I thought he might be like a celebrity doctor or something. But I got right in, and he looked at my facts and said, "You need a biopsy." And we did the biopsy that week, and a couple days later he said, "You do have prostate cancer," and he thought that the gold standard for prostate cancer was a prostatectomy, surgery to remove the prostate robotically, as he does it. It's like arthroscopic surgery in a way. It's not an open surgery. They take some instruments and go through some holes with cameras and cutters and removers, whatever they do. And it was painless operation. He put me up in a lovely hospital room and went home the next day. There are worse cancers, there are worse experiences with cancer by far. But so if you're going to have it, I think this is the way to go. There are other options, besides surgery: radiation, seed implantation, watch and wait, see what happens, alternative medicines, and all these different things. But apparently the one with the easiest way to go through it is the robotic surgery. If there's an indication that your PSA is rising speedily, for instance, I would say make sure you see a good urologist and have some other tests taken. It might be a biopsy, it might not be. Oftentimes it's good to watch and wait, but you have to be very aware of it because it can sneak up on you. Yeah, everybody should be tested after a certain point, 50, 55, 60, unless you have some familial occurrence, your father, your grandfather, your brother, then it would be earlier and more often. But these are things you have to put up with. Generally speaking, I have a pretty good life, and I can do the things I've always done. So, you'd rather it didn't happen. But since it did, you have to put up with it, and I'm almost 80 years old, so I can't complain. I've had a good life, and I expect Dr. Samadi assures me that it's going to go on for quite a while.